Post-pandemic, more and more services are being accessed online. And now a new report explores how virtual care is shaping healthcare access in British Columbia. The province has built a network of virtual medical services to try to improve access in rural and First Nations communities. The CBC's Jennifer Yoon is tracking this story for us. Okay, so what did the report find, Jennifer?
So the report, which was published this morning in the Canadian Medical Association Journal, found that use of these services increased year by year. And the service in particular, the program they looked at, is called Real-Time Virtual Support. And one of the things that it does is that it helps connect rural nurses, rural doctors with their colleagues, other physicians in other parts of British Columbia who have a little bit of experience working in rural, remote communities and have specialized interests or training in certain aspects that may not be present in some rural communities. So that might mean a video call between a rural doctor or a nurse and a specialized doctor talking about a complex case. Or in some cases, and we know this has happened, when a baby comes early, the hope is that the mom is flown down earlier before the baby decides to come. But, babies come when they do. And when they do, the virtual doctor helps nurses and doctors who are on the ground who may not have delivered a baby in quite some time and walks them through the process of childbirth. And I want you to take a listen to Dr. Melissa Paquette, who is one of the doctors that helps virtually her colleagues in rural areas deliver babies and then transport the mom and baby to another place down south.
Delivering babies is more than just like catching them as they come out. Delivering babies involves the knowing what to do, what to watch for, what to check, what the steps are in supporting babies. So they did a lovely job. They called us really early to say, she's in labor. We aren't able to get her out as soon as possible. We've already notified the transport system, but she won't be able to leave our site until after she's had the baby.
So in these cases, what doctors do is they get on a video call and then they end up on an iPad in the corner of the delivery room. The mom is giving birth and the doctor virtually says things like, hey, can you check the fetal heart rate? Why don't we try moving the mom so that she's in a different position? And that might help the childbirth go along smoother.
That entire process, I'm sure, makes some expectant mothers maybe a little bit nervous. Yeah. What has reaction been like to this?
Well, it's one of those things where if you're in that situation, if you're a mom and you need that help, or you're a doctor who hasn't helped a woman give birth since residency, that kind of help is crucial. But at the same time, some say it doesn't actually address the root causes of the problem. And I want you to take a listen to Dr. Gavin Parker. He is the head of the Society of Rural Physicians of Canada, and he thinks that this could be helpful, possibly in other parts of Canada, but also he has some criticism.
I think anything that provides better access to rural patients is an advantage. But I think what this study underlies is the fact that we are significantly understaffed in family medicine in the rural areas. It's a problem that's been going on for a long time, but it's been exacerbated in recent years.
So he compared it to a lifeboat. This program is saving lives, potentially, helping people, definitely. But ultimately, at some point, we have to talk about the root causes of the problem causing staff shortages in rural and remote parts of Canada.
Okay, thank you for this, Jennifer. That is the CBC's Jennifer Yoon reporting.